Broadcasting from the Cass Corridor in Detroit, this is The Metro. I'm Robin Vincent.
And I'm Tia Graham. Today on the program, much of the global fashion industry is unfriendly to its workers and the environment. How do we take it back and grow sustainable fashion here in Detroit?
Plus, overdose deaths have been trending down nationally, and that's a really good thing given how high those rates have been. In Dearborn, those numbers have gone down even more.
And autism has been in the headlines a lot as Health Secretary RFK Jr. aims to spotlight the condition. We'll fact-check his claims with a local advocate. But first, so much of who we are is determined by our memories. Whether conscious or not, if we begin to lose information about our past, we start to lose an understanding of who we are. That's why many people are afraid of dementia, which significantly impairs memory. And we just got new information about that disease. A recent New York University study shows Americans have a 42% chance of developing dementia after age 55. That's more than double the risk reported by previous studies. By 2060, the U.S. is expected to have 1 million new cases of dementia each year. May is Older Americans Month, and as we approach that time, we wanted to ask, what do we know about the causes of dementia? And is there anything we can do collectively to delay it or to alter its course? A new study by Bowling Green State University sociologist Janjira Yahirun found that parents of college-educated adults are less likely to experience dementia or cognitive decline. That's right. If your kids have a college degree, you're less likely to get dementia. Given that most people emphasize the importance of biology on dementia, WDET's Sascha Raiyn wanted to understand the social causes of dementia. The two began this conversation discussing the work of the sociologists behind the study.
I've been doing this work for a while now, I think over a decade. So my research really just in general looks at how children's education influences older parents' health. And I should say that this is adult children. So I'm looking at mostly children who are the ages of 25 and older. And the study that I think you're referring to is the study that I most recently completed, and that is showing how basically children's education is related to parents' dementia onset. And so dementia risk for older parents is associated with their children's level of education. What we found was that actually having a child who did not complete high school was really a really big risk factor for parents and their dementia onset.
Let's back up a little bit. So why are you studying this? Why are you studying how an adult's education affects their parents' health?
Yeah, well, there's been, so I'm a sociologist, and so I'm interested in, my areas of interest are really family and health. And so there has been a long line of literature suggesting that, the social conditions, the family structure, the social conditions of the family in which you grow up in have long-term effects on your health, right? So like you can think about, the type of housing that a child is living in as as an infant or, as a young person, or the types of resources that parents have. Those will have long-term effects on, the health of a person as they age into adulthood, and then, even longer, as they enter into later life. But I'm kind of flipping this around on its head a little bit and asking, well, okay, we know that these early life socioeconomic conditions can affect your health, but what about, thinking about the conditions of later life, and specifically thinking about how the resources of younger generations can actually affect older generations. Children who do have more education can provide more financial support to parents, for example. But even accounting for that doesn't completely explain the association between having a highly educated child and parents' dementia risk. Some of my work has looked at how having highly educated children leads to lower depressive symptoms among parents too. So, if you have highly educated children, people might see this as a source of pride. Parents might see this as a source of pride, but, at its most basic level, it could also mean that parents they experience less worry and less anxiety about children's future. And we know that there is actually a pretty strong link between mental health and cognitive health as well.
This does suggest that dementia is rooted in something like stress.
Oh, yes, absolutely. I think the research is very clear about that, actually. There's, we know that dementia is, there's different parts of dementia, and, there's different theories out there about what causes cognitive decline. So there's this theory. The first theory is really kind of just thinking about kind of the stock, essentially kind of the cognitive stock. It's called the cognitive reserve hypothesis, and that's this idea, that you have basically built up over time, and usually that happens in the early part of life, like some capacity to kind of maintain good brain health, right? So that's through kind of early exposures to schooling, education. The type of job that you have likely influences your cognitive stock. But then, from kind of the period of adulthood to later life, that's kind of the question that people, I think, are trying to figure out, what is the link there? And so there's a lot of sociologists, including myself and other social scientists, who are really interested in thinking about kind of the interactions that people have and the social networks that people have that might help to delay cognitive decline.
So when you look at this data, you're isolating education data away from like income data and other kinds of data that we would still associate perhaps with education?
Yeah, definitely. So we control for just a number of socioeconomic characteristics, right? So we control for things like gender, race, ethnicity, marital status, number of children, and then probably we don't actually control for education because these data are for people who are above the age of 50. So there's a little bit of a problem because a lot of our sample is actually not working. And so that's where we figure income is actually not the best control. We have controlled for wealth in the past. So, for example, the basic indicator of wealth that most sociologists use is home ownership. And so we have controlled for that. We didn't control for in this model, but we have in the past, and the results are robust.
So what should we do with this information? Now that we have it, what do we do with it?
Yeah, I think probably one of the biggest takeaways is that we often think about education and socioeconomic resources as, it has the ability to, education at its basic level, right? It has the ability to lift people out of poverty. We know that. We also know that it has the ability to kind of allow people to, a certain level of education will allow people to have a stable, financial or economic stability. But I think the biggest thing here that we see is that there are spillover effects. And it's not just, kind of what we typically think about when we think about spillover effects, like as a parent, obviously a parent's resources will have spillover effect onto younger children. But here, I think, increasingly there's evidence that there are also benefits to older parents as well. And I think that's kind of the key takeaway message.
I thought that there was a genetic component to the likelihood that people would experience dementia later in life.
I don't want to say that there's not, because I think there is a genetic component as well. But I think that when we focus just on the genetics, then we ignore kind of environmental and social factors. And in fact, the social and environmental factors are as important as genetics, if not more important. You're probably familiar with like the field of epigenetics. So that's right. Like that's this idea that people with maybe the same or similar genetic stock. So this would be like twins, right? People are really interested in twin studies. So, people with the same genetic stock go out into the world, and let's say they experience, different types of social conditions. It turns out that their social conditions, their social environment actually, interacts with that genetic stock. Then to have these kind of different, then that leads to different health outcomes.
So other things that you've studied relative to education, other health outcomes, I guess, that you've
Yeah,
looked at.
so I've also looked at depressive symptoms. And so it's a similar finding there. We basically just looked at whether or not having college-educated children was related to parents' depressive symptoms. And this is also using the same data set in the United States, the Health and Retirement Study. And we found really similar results. So basically having more college-educated children was related to lower depressive symptoms for parents.
That was WDET's Sascha Raiyn speaking with sociologist Yahirun about a new study on dementia finding that parents of college-educated adults are less likely to have cognitive decline. From the WDET newsroom, in politics, the state house passed 2 bills moving $115 million in sales tax revenue into a new fund to fight violent crime in neighborhoods where it's the highest. The bipartisan legislation specifically supports community violence intervention programs. We'll hear from someone in that group later in the show. And the Vatican has opened St. Peter's Basilica for people to pay their final respects to Pope Francis, whose body will lay in state until Saturday's funeral and burial. And in sports, the Tigers lost to the San Diego Padres 2-0 at Comerica Park. Starting pitcher Jack Flaherty gave up the game's only 2 runs at the top of the second inning, and Flaherty struck out 9 batters in 6 innings. The teams wrap up their 3-game series this afternoon. And coming up next, we're going to talk about sustainable fashion in the city of Detroit, and we do want to hear from you. How have your fashion habits changed, if they changed at all? The number is 313-577-1019. We'll be right back on the Metro. You all stay right there.